Hi, my name's Anthony Weller. I'm the interdisciplinary GP here at ATUNE Health Centres, and I just want to take a moment to introduce you to our lifestyle program. We're going to call it a lifestyle prescription, and it's a really important concept. The take-home message from this is that it's not rocket science, but it's really important that if we can do the simple things really well, the health benefits are really huge. The background of this extends for a very long period of time, and it's common across all disciplines. There's a lot of talk of lifestyle medicine at the moment, but both in traditional and complementary medicines, the philosophies that we're going to speak about today have been around for a very long time. What's important to recognise though is that we tend to say that we're pretty good at things. And especially in Australia, we say, oh, it should be right, mate. You know, I'm pretty good at my diet. I'm pretty good with my fluids.
But when we analyse and compare to established benchmarks, we actually find that we're often falling quite significantly short when we sit down and think about these things. If we can spend time focusing on doing the simple things really well as our foundation, as a lifestyle prescription,
what we're going to notice is that our reliance upon medications or our reliance upon health programs, whether that's through the dietitian or through the movement-based practitioners, our reliance upon specialists,
our reliance upon surgeries and high-level interventions is all going to decrease if we can get our focus on doing the simple things really well in our lifestyle prescription. And that's what we're going to spend time focusing on today. Like I said, the principles are not new.
You'll hear them in different ways across different platforms. There's a few elements that are specific that I want to address with us. And the other message that I really want to get across to both existing ATUNE clients is that a real point of difference in ATUNE is that we've got the different health professionals to be able to help you to tackle these different areas and line everything up really well. And it's all in the one space. So the convenience is there, the communication is there, that teamwork, that we call it a multidisciplinary approach.
And we see it a lot in the hospital systems done really well. It's a harder model to do in the community normally, but it's something where we really excel. And it's so convenient to be able to have it all done in a one-stop shop. So please engage with the different modalities and let us work on these foundation principles.
Because it applies whether you're seeing the dietitian, the osteopath, the naturopath, the GP, the breathing therapist. We all are going to go back to these simple principles, and it's going to be relevant across the board. So our model is called SHAPE, S-H-A-P-E. I am blatantly a daggy dad, and I'm very proud of the fact. So I like to come up with a coin phrase with it. So get into shape. So let's get into shape, but also let's grab the bull by the horns and let's take the initiative and get into it as well. So I'll run you through the components. I'm not going to take the time in this session to break each section down. We will cover that. I just want to give you the overview of our SHAPE lifestyle prescription. So S is for sleep, H is for hydration, A is for air, so are we breathing effectively and is our breathing function optimal, and it often isn't. A is also for alliance, so that positive connections both within yourself from a holistic point of view, but also the alliance that you'll have between your doctor and yourself, the alliance that you have between the other health professionals and yourself, and the alliance that we have here at ATUNE. Alliance means working together for a mutual benefit, an association working together for a mutual benefit, and we can do that in multiple ways here at ATUNE for you. P is for preventative activities, and again, it's one when we're busy we often overlook, but what can we be doing today that is going to set our health up for tomorrow? E is for eating, and E is for exercise. What I want to spend a bit of time from in the following vlogs and presentations that come up is a lot of the ones that you've heard of before, eating and exercise. That's fine, and we will go into those, but a lot of people have heard the information about it. But why is sleep so important? How does sleep impact on certain things? How does it impact on mental health? We're going to explore that in a little bit more, because a lot of people think it's okay when it's actually more can be done. Why is breathing functionally so important? It's an area that we often overlook. We're breathing, therefore it must be okay, but there's things we can do better. Hydration is a huge issue, and we're going to explore that a bit more. And it impacts not just on our physical health, our mental health, but also things like our musculoskeletal health as well. And we'll talk a bit more about these in the sessions going through.
So, the introduction to the lifestyle prescription shape: sleep, hydration, air, alliance, preventative activities, eating and exercise. Look forward to exploring this a bit more with you later.